In the headlines today, acetaminophen no better than placebo for low back pain, how effective are herbs for back pain, and low back pain increasing global burden of disease. Around the world, medical guidelines for low back pain recommend using acetaminophen, also known as Tylenol or Panadol. But no one ever tested to see if it worked, until now, and they found it's no better than a placebo. 1,600 people were randomised to either placebo or medication for 3 months. 3/4 were satisfied with their treatment regardless of whether they took placebo or medication. There were no differences in recovery time, pain, disability, function, symptoms, sleep or quality of life. However, if you do have back pain and want to try a mild analgesic, then try acetaminophen and see if it works for you. And if it doesn't, don't worry, just remain as active as you can, and in 3 months, voila! A new Cochrane review looked at which herbs may be effective in the treatment of low back pain. 6 herbs were trialled and compared with placebo, then the results were reviewed. The herbs used were devil's claw, white willow bark, cayenne cream, comfrey ointment, Brazilian arnica gel and lavender essential oil applied with acupressure. Cayenne cream seemed to have the most reliable results, but all the herbs appeared to show some benefit so that drug medications could be either replaced or reduced. While the scientific method was described as being poor or very poor, there were no serious side effects, so they may be worth a try, especially if acetaminophen is no better than a placebo. Low back pain is on the rise according to 2 new Australian studies. Almost 10% of adults were found to have low back pain at any given time, with a peak prevalence at about 80 years of age. Low back pain is the most common cause of disability, and a second study looked at the global burden of low back pain in terms of occupational hazard and estimated that the human cost globally is much higher than previously estimated. Researchers have found that low back pain accounted for 28% of all healthy years lost to disability, and that men aged between 35 and 55 are most likely to be affected. So men, take care of your back, especially when you're at work. I'm Dr. Nerida McKibben, and that's today's Health News.